All right, I'm joined by Dr. Marc Harrison, the new president and CEO of Intermountain Healthcare, and I think we should say welcome back.
Thank you. It's really good to be back here in Utah.
Tell us a little bit. We want to get to know you. What's your background? You just recently came from Abu Dhabi.
That's right. My wife and I are both pediatricians trained at Primary Children's, and we were here from about 1990 through 1997. After that, we moved around a little bit and spent the last 17 years with Cleveland Clinic. And the last 5 of which were in Abu Dhabi, starting in Cleveland Clinic, Abu Dhabi, and it's great to be back here in Utah.
What made you come back?
It's really Intermountain Healthcare as well as the incredible community that we're in. Intermountain, as you know, is really designed and is executing against population health in a way that is really quite inspirational to me. We're taking care of people, keeping them well, keeping them healthy, and it's just terrific to be back near the mountains and near the desert as well.
The short time that you have been here, what priorities are you seeing? What changes do you think that you want to tackle first?
So really it's about keeping healthcare both accessible and affordable. And that really is the name of the game these days. And you know, we've really transitioned to a large extent away from the sick care model to the health care model. So I'm really very happy that we're working well with our insurance subsidiary, Select Health, to develop products that are encouraging people to really take great care of themselves. And then we've set up our primary care and our preventative care in such a way that we're seeing really nice advances in keeping people well, keeping people out of the hospital, keeping people back at work and with their families.
What kinds of changes might someone see for you coming in?
With me, I think there's going to be a really big emphasis on wellness. So I personally am a person who's a cancer survivor myself, and I believe that I've been successful in getting back to work because I've taken good care of myself. So I'm working hard to make sure that we set up the system in such a way that each person is motivated to do as much as they can do to keep themselves well and to be as functional as they can with their work and with their family.
And so what I'm hearing is a lot of preventive care maybe.
A lot of preventive care. You know, we really work hard to try and put ourselves out of business. I don't think that's ever going to happen, and we're thrilled to have 22 terrific hospitals across our state that are designed to provide excellence in acute care. But in some ways, it's a bit of a failure if we have people with chronic diseases who end up in those hospitals. So we're working really hard to keep people out of the hospital and in their society.
And any new plans that we should know about?
I think the biggest plans are around how can we innovate around keeping healthcare very affordable. A great example is our Connect Health product, which is using distance health for both primary, secondary, and now tertiary and quaternary care visits to keep people as close to home as possible.
And that's almost like using almost like a FaceTime kind of situation.
You can use your phone, you can use your tablet, you can use your desktop, and you can see primary care professionals 24 hours a day. And we also are using that to support our hospitals, from the ICUs to the wards, etc.
It sounds like your background is in pediatrics. That's where your heartstrings bring you. Any changes there in that department? So
I think from a pediatric standpoint, we're thrilled with the job that both our pediatricians, family doctors, as well as Primary Children's is doing. And one of the things that's very exciting for me is to see people now flying into Primary Children's from around the country for some of the subspecialty care that's really quite terrific.
All right, well, welcome Dr. Marc Harrison, the new CEO of Intermountain Medical Center. Glenn, back to you.